Welcome to the Business of Medicine podcast from the Southern Medical Association. Since 1906, SMA has had a singular mission to provide medical professionals with the resources they need to learn from each other and in doing so improve the overall quality of patient care. The Business of Medicine podcast is dedicated to exploring and simplifying the varied and complex business aspects of running a medical practice so that you can do what you do best, provide your patients with the highest possible standard of care. To learn more about SMA's many other services and educational initiatives, please visit us at sma.org.
Welcome to another episode of Southern Medical Association podcast. We have Dr. Migita from Seattle Children's Hospital with us today. This talk is about an advanced total production system. The purpose of this talk is for some of our folks that, some of the audience that have already have a basic understanding and fundamental knowledge of total production system. And so our goal is to take a different approach, and I have collected a number of questions. I call them advanced questions in TPS, and we're very excited to have you, Dr. Migita. And let me start up with my first question on this topic, and that is medical care, in hospital. We need a highly coordinated effort between silos within different part of the hospitals, lab, pathology, radiology, different units. And this is one of the key things in our medical care, that we have this coordination between them. What are the most important items to consider when building a relationship with silos?
It's a great question. And I can really tell just by the nature of your questions that you're really starting to understand what this is all about. There's nothing that beats face-to-face communication. And there's nothing that beats getting people who are not necessarily in your area, your silo, as you mentioned, on board with the plan. So my advice is very simple, and we work in multidisciplinary teams all the time in our clinical standard work teams. Really, it comes down to this. You just go to those suppliers, as Toyota would call them, or other areas, ancillary services in the hospital, and you just talk to them. You say, look, we made a promise to our patients, our customers. We promised them that we would cure them of their disease. And to do so, we need to, say, for example, not make errors. Or we need, for example, to ensure compliance with this medication. Or we need to make sure that we get the medications to the patient's bedside in a very short time frame. So you want to bring them in and remind them of the why we're doing this together. And you say, we made this promise, so can you help me? What you don't want to say is you don't want to say, well, it's lab's fault, or it's the ED's fault, or it's pathology's fault, or et cetera, et cetera. This is just more blame. In some cases, if your sub-assemblies or your silos are not helpful or refuse to help, then you could try to learn the key skills that they have yourself. But it's much better to bring them in. You're going to need expertise from every area of the hospital to solve complex problems. So teamwork is just important. So I guess again I leave it with this. Share the reason why you're in this together. It's very simple.
Well, in one of the previous talk on our podcast, you mentioned that the first iteration of the standard work should be fundamental. So what does that mean? How do you discover fundamental work?
Right. Great question. So there is standard work and there's fundamental work, and they're one and the same. But fundamental work is where you start. So say, for example, you have a process. It may be a fairly complex process, but definitely something that requires specialized training. If you wanted to write standard work for that, the very first time, say you've actually written standard work for this, I would get two people who know how to do the job, two experienced people. And then I would have them do the work and have them write the standard work, the steps and the time. And then after they perform that task, the task at hand, look to see who was the most efficient. Look to see who made the fewest number of errors. That's the work you should start. That's the standard work you should start with. That is the most fundamental. So there's a philosophy in TPS is you must always be willing to be honest with yourself and others and be able to say, this is what I can do and this is what I can't do. Okay, you can't blame people if mistakes are made. Mistakes are gifts, really. Mistakes are seeds, essentially seeds to Kaizen. And this is why newcomers, when they come to an institution and they know nothing about the standard work or how the processes are done, this is why they're so important, because they come in and they are tests for your standard work. If you cannot train them successfully in your standard work, then something is amiss with your standard work. Standard work is designed to set a pace. Standard work is designed to be improved upon. You want to write standard work that everyone can do, right? And that gets back to the idea of fundamental work. When you are pushing forward either in a factory or in a patient care setting, you don't want the work itself to delay the line, the stoppage of care. In a factory, it's stopping the line, but in a hospital, it's stopping the care. You don't want the work itself to stop the care.
That's correct. Yeah.
Right. You want the problems to stop the care, and you want the problems to be visible. So this is why we say go to Gemba, another Japanese word. Again, you can use any words you want. Gemba just means a place where the work is done. So the truth is always there. It's always there. And engaged leaders that understand this, they know why workers suggest a certain change to a certain process, because they know the work well enough to understand why that's an important suggestion.
If someone goes to Japan, like you went to Japan, or any other factories, they can go to Boeing here, in Washington, or any other places to learn Toyota Production System. How do we teach others in our hospital to follow us that they have not been part of this journey?
It's the problem that any institution will have when they bring in a new set of ideas. What I would say is you will likely send your true believers, your top 1 to 3% of your innovators to Japan or wherever else. Even in the United States, there's some fantastic examples of lean manufacturing. When you come back, there's going to be jealousy. There's going to be skepticism. There may even be just frank anger. So you need to go to Gemba. You need to go down. You can go down to where the work is done, and find out what you have, because you might have a treasure down there. You might have people who are absolutely ready to follow you into battle. You might have that. You might not. But at the end of the day, you need just to find a few people that are willing to try. And the middle 50% of your work staff will eventually follow. The actively disruptive people will always be actively disruptive. There's no reason to try to convince them. So go down to the floors, the units, the labs, the pharmacies, and find out who your true believers are. You see, the treasure of a company. The treasure of a company are a few things. It's its money, obviously, profitability. You must think of that first, of course. In manufacturing, the second treasure after money is the factory's raw materials. It's how they make their products. So you can consider that patients in a hospital, those are our raw materials. And I don't mean to depersonalize patients. And the third treasure for an organization, hospitals included, is its people. So you have to solve the problems with your people, not just with money or top-down ideas. If you have complex problems, you want your people to be coming to you with new ideas all the time. So in order to do this, you need to spend time as a leader on the front lines. You need to show up in Gemba so that your people raise their concerns to you. You need to show up there to understand the changes they're making. Your ability as a leader, if a leader was a treasure to an institution in any way, your treasure to the institution as a leader is your ability to assess a worker's performance. And how can you do that unless you go down and watch them work?
going back to the concept of Kaizen and also what just you mentioned about your staff, regarding Kaizen and getting new ideas as a leader, how do you respond to suggestion from a frontline staff?
Well, suggestions, that's gold. It should be treated like that. And when you get a suggestion, you can do three things with it. Essentially, you can implement it. And if it's a great idea, implement it immediately. You could, secondly, ask that the worker does more research on that topic, to go back and maybe work the 5 whys a little bit more. That's another option. Or you could just decline it completely. But you have to be careful about declining a Kaizen suggestion or an improvement suggestion, because you could very easily discourage that person from ever suggesting anything again. So if there's anything about that suggestion you can employ, then I would do it. And then you have to take time to praise them for having the courage to make that suggestion. One of the most amazing gifts that a leader can give to their workers is to let them implement their idea. It's so powerful. It's so simple. Yet I see so many leaders doing just the opposite. And that really chokes off the capability of every human to improve and achieve things. We can't stop the line in medicine, and it's hard to stop and assess the validity of everyone's opinions. So often you need to just try something. You need to try something new if you have a problem. It takes a lot of courage to do that.
From your previous podcasts on Lean and Kaizen, it made me go back and review some of the concept in TPS. And one of the things that I read about, and I hear about it a lot, is the concept of building quality. How would you say about the building quality?
Building quality is a concept that was born from manufacturing, obviously, and maybe to really understand it, maybe I'll take an example first from industry, and then relate it to an example in healthcare. So at Toyota, right up to the point that the car is delivered, they do a lot of testing on the product. They do waterproof testing, they do acceleration, braking testing. They run the car in harsh environments, hot, cold, wet, etc. So you want to test the car in many conditions because you don't want it to fail, obviously. But in order to know what tests you're going to do, you need to really understand your product. You need to understand it intimately, so you know what quality checks are needed to ensure that built-in quality. I hope that makes sense. So, even the people doing the testing need to understand their importance.
Yeah.
They need to understand that I'm here doing this testing because I'm building in quality so this product doesn't fail. Now our stakes are higher, I would argue, in medicine. And I relate the concept of building quality to our clinical standard work pathways. Our pathways have an algorithm that our practitioners use and our nurses use. It has an order set. It has a set of metrics. And it has a set of processes to ensure that those recommendations are applied to the patient in a timely fashion. But we often test our product, and we use simulations. Sometimes we actually even use mannequins with simulated vital signs and respiratory rates, et cetera, to really test the products to be sure that they work in our care space. It's not unlike crash testing a car. It's not unlike those tests that I mentioned earlier. So building quality is very important, and it can be applied in a variety of settings.
If you make an improvement in part of the hospital that impacts another part of the hospital or in our organization, how would you synchronize these improvements?
Oh, from one silo to the next, right? That's a really great question, and the answer, again, like much of TPS, may be a somewhat of a paradox. So, say for example, through Kaizen and change that a process that's downstream of a certain process became faster than a process that was upstream of it. So now you're going to have an unbalanced process, right? So this could be, say, an OR where we are able to clean the rooms really quickly, but we're not able to deliver the next set of instruments to the room as quickly, or we're not able to sterilize our instruments fast enough. What you might have to do, and this seems counterintuitive, is you might have to slow the process of room turnover down so that you can speed up the other two processes that I mentioned. And this will keep the line balanced. This will prevent waste. So this is how you get total maximum efficiency. But what often happens is that one part of the process has tremendous success, but the other processes don't. And all that ends up happening is you end up either overproducing in that process that's more efficient, or the other two upstream and downstream processes simply give up trying to be more efficient. So sometimes you got to slow things down. You got to take a long-term view, slow things down, speed up the processes around it, then turn it all back on. And now you really have flow of patients, flow of materials, flow of information. And that is how you tie processes together through Kaizen, through TPS.
One of the questions that I was curious about was, you talked a couple of times about Mr. Uno. Do you know any of other stories about Mr. Uno?
I have some. I wish, they're all secondhand stories, but let me think. So one classic story from Ono is that he would, as a leader, he would come down to the factory floor, and he would, he knew the work. He was a technician and engineer himself, and he would look at a process and say, the problem is right here. It's not there or there or there. It's here. And then he would go to the worker and say, you must solve the problem. So he would actually know what the problem was, what the root cause was, and what the appropriate countermeasure was. But he wouldn't say it. But he would stand right in front of it, sometimes returning day after day, until the workers figured it out. He would say, what's been done to solve this? He would just stand there until the problem was fixed. So this is a leader who knows the work and who's trying to draw out the creativity and intellect of every worker on the factory floor. Imagine if hospitals did the same.
Wow, that is fascinating. My next question is, okay, you try to improve something. And as you're trying to improve this, you realize, okay, this is difficult. And there is no immediate success. And sometimes you may think, okay, this is not going to work. How do you maintain that stamina?
Yeah. Well, first of all, you have to believe. And I mentioned, I think 1 or 2 podcasts ago, that when things get difficult, that is when, as a leader, you have to believe it. Praise is something that should never be underestimated. Praise is important. Complimenting those around you and actually complimenting yourself is important to keep it going. Like I said, TPS is a long-term view. You have to be willing, and you should be thinking about saying, hey, I did this. I brought TPS to this team. If someone does something new and innovative that took a lot of courage, you say, great job, you did it. You did it. You tried it. And say this to yourself. I tried something difficult. How many times do people fail before they succeed? You don't have to look far in history to see examples of this. I mean, I don't know how many thousands of experiments Thomas Edison did to create the light bulb or to create the telephone. I don't know how many iterations of, certain statues like that Michelangelo created, how many iterations he went through to create David. There is no question that this is hard work. So the stamina comes from the why. The stamina comes from the mindset and the mission. And leaders need to portray every day, an aura of positivity, an aura of that this is important and it's going to be a struggle. There has been not a single clinical standard work pathway has started and finished without a great deal of struggle, disagreement, technical difficulties, prolonged literature reviews, achieving consensus across multiple care areas. They're all struggles. But we have gone live with every single pathway we've started. We have never aborted a project, ever. And it's because our teams understand this, and we cultivate this mindset that we will not stop until we have improved things.
Since you mentioned about the cultivation, how do you cultivate a sense of urgency?
Urgency can come from many places. It starts with leadership. You always have to challenge yourself to do more. You always have to be able to willing to say that this it may be good, but it can be better. It can be better. I think the first step is creating standards that everybody can do. So that's a baseline first step. And then you can meet your goals as they become more complex and difficult over time. Urgency, all this innovation, by first starting with standard work and iterating on it, at Toyota can be seen in the moving line. So if you go to a Toyota factory, the cars move at a certain velocity in front of the workers, and as they pass the worker's station, the worker must complete the task for that particular station before the car moves along to the next one. If you are at Boeing in the Renton, Washington plant, the 737 plant, the plane actually moves very slowly along this line, and components are brought to the fuselage of the aircraft until it literally flies off the end of the assembly line, literally. So the sense of urgency in those two scenarios is actually moving right in front of you. The sense of urgency is the moving product. So what's the sense of urgency in a hospital setting? And there's many examples. Take sepsis, for instance, a life-threatening infection that can kill patients. That does kill patients. Thousands of patients a year die of uncontrolled infection. We know from the highest levels of evidence, medical literature, that the faster you deliver IV fluids and IV antibiotics to the patient in a dose-dependent relationship, that those patients survive if you get those key interventions done in a timely fashion. What can be more urgent than that? What can be more urgent than that? So the sense of urgency is all around you, but you must make that visible. How many hospitals know the time it takes to give them a septic patient's antibiotics? How many hospitals know it? How many hospitals post that? How many hospitals basically advertise that problem so it's fixed? What does that do? That is a sense of urgency.
So now we're getting our staff and our people involved in the process. So the question is, how do you get people to not simply stop working when extra capacity is created?
Right. How do they not sandbag it? So, there's some that you won't be able to stop, and that's true. But the key is not. That's not where the key isn't necessarily having a conversation with people who are actively disruptive. That you don't want to spend your time doing that. What you want to do is you want to link people together. You want to link them in such a way that they depend on each other. So think about there's an analogy in Toyota that Taiichi Ono described. He made a lot of sports analogies, but one of them is a swimming relay. So what do you see in the Olympics? One swimmer launches off the block, swims their 200 meters, and then when the next swimmer in the relay can't leave the starting block until that first swimmer has touched the wall. Okay, this is actually sort of inefficient if you think about it, to cover that distance in the pool in the shortest amount of time. What's more efficient is a track relay. So think about a track relay. I mean, the 4x100 is what you see is that they are linked together. There's a zone in which the runners can pass the baton, and when you're receiving the baton, you can either speed up or slow down to receive that baton in the most efficient fashion. So much so that the times it takes to do the relays are incredibly fast. So this is the analogy I'm trying to make, is that you want to set up a system of passing work along where there's a zone where people can go and help each other. They can go backwards or forwards and help each other. And if you set up systems like that, people won't sandbag it.
So when you see something that needs to change, what do you do first?
Well, it's I think it gets back to focusing on why you're there. In many organizations, anywhere, people tend to focus on each other. What is this guy doing? What is that woman doing? And they tend to evaluate themselves in relation to other people. So when you focus on that, you often go in circles. So what you want people to focus on is the why. Why are you there? What are the goals? Goal setting by leaders is so important. And it's very easy not to set goals. When you go to the front line, it is strikingly obvious what people are accountable for. You go down to the emergency department, there's a waiting room. Walk in. You can see how full it is. When the patients walk out, you can tell if they've had a good experience or not. You can see the accountability of the front line. Now go to someone's office who's a senior vice president or vice president or director. Can you see what they're accountable for? It's very hard to see what they're accountable for. So in terms of getting things to change, if I were to evaluate an organization, I would go to the top levels of the organization. I'd walk in their office. I'd see what's important to them. I'd go to the director level and see what's important to them. And then I'd go down to the front line and see what's important to them. You can see this, and you can tell. You can tell if this organization is going to succeed. So the first thing to change is that goals have to be through every level of the organization. They have to be shared across those levels of the organization. That would be the first thing I would look for.
So another things that I hear at in the hospital or when we are doing a project is that when we have lots of design changes, it's hard to finish the work. What do you do at that point?
Right. It's the perfect becoming the enemy of the good. You're going to have design changes in any project. You're going to have last minute changes. You're going to have last minute requests, and that's natural. I think it's getting consensus is another art form. In Japan, it's done by a process called nemawashi. It's relatively slow, but sometimes you don't have that time in healthcare. So my advice would be you get a baseline consensus. You go live with a new process. It doesn't have to be perfect. You have to recognize it won't be. And then you level up and you challenge yourself and the team. Over time, you iterate on that change. But you first have to make sure that there's rules and there's standards that people follow. But remember, standard work is there to be changed. It's there to be improved. I think that about covers that question.
Comparing the healthcare to manufacturing, there are many roles in patient care acting like sub-assemblies. So how can we improve communication between these sub-assemblies?
I think in a way it gets back to, I think one of the first questions you asked me is you go and you find your sense of urgency. You communicate that in person to your sub-assemblies or other silos. You reinforce that you're in it together. There's really no single answer to that question. It's a great question, but it's about the why. It's about urgency. It's about communicating, and it's about having very clear goals that are supported from the top levels of the organization. The more you bring multidisciplinary teams together, the more frequently you bring them together, the better your communication will be. I have seen many, many times through many quality improvement projects here at Seattle Children's that when I see people arguing about what to change or if something's a problem, I know I have an issue. As the lead. when I see groups of multidisciplinary teams, when I see individuals in those teams arguing about how to solve a problem, I feel my work is largely done. And that's the type of disagreement you want to see. That's the type of communication you want to see. You want to see passionate argument about how to fix a problem.
Dr. Migita, thank you so much for coming on board again. This was one of the most fascinating podcasts that I have conducted at Southern Medical Association on advanced total production system. One of the things that I really would like to do is to have you back on our podcast and talk to us a little bit more about clinical standard work, as you alluded to that plenty of time throughout this series of Kaizen, Lean, and Advanced TPS. And we would love to have you back and have a session on clinical standard work.
I would very much enjoy that. Thank you so much for this opportunity. I greatly appreciate it.
We hope you enjoyed the business of medicine. For more episodes in this series or SMA's The Practice of Medicine podcast, go to sma.org/podcasts or subscribe to us on iTunes, Google Play, Spotify, or wherever you get your podcasts. For more information about SMA's mission, please visit us at sma.org, and thank you for joining us.